Imagine yourself in a car and you're driving on the freeway when all of a sudden you're rear-ended. Your neck is severely damaged and you're having to be put in the hospital and go through surgery. My stepmom was about 22 years old when she was in a car accident. She is now 34 and she's been through almost 4 surgeries in her neck, one including a bone fusion of 2 vertebrae to support her neck. She's gone through multiple pain medications, having not wanting to become addicted. Her pain can become so bad as to not be able to get in a car and drive down the street because of the bumps causing her pain in her neck. She switched to using medical marijuana. Now having 3 kids, she's told them now that they understand that she does not use marijuana for recreational use. She uses it for medicine. Now, not having a clear cut about not using drugs and not using alcohol because of the way the state and the federal government have fought for control, she now had to explain it to them. In this speech, I'm going to argue that the H.R. 2306 bill should be supported for state control. I have 3 main points to support my argument. First is that the Schedule I drug list and the Controlled Substance Act create limits for research. Second, I will argue that if we move marijuana off the Schedule I drug list and onto the Schedule II, it can create less boundaries for research. And third, I will argue that marijuana does have some medical properties. So first I'm going to talk about is the Schedule I drug list and the Controlled Substance Act. Now, the requirements for a Schedule I drug list is to have a high potential for abuse and no scientific evidence of medical benefits. For Schedule II drug list, it should have a high potential for abuse and some medical evidence of medical benefits. So that would be considered as morphine and Vicodin because you can become addicted, but it's also used for surgeries or pain relieving. For a Schedule III drug list, it should have no high potential for abuse and scientific evidence of medical benefits. Now, those would be considered as Tylenol, ibuprofen, something that you can get at a store without a doctor's prescription. Now, on Chapter 47, Uniform Controlled Substances, Subchapter 2, suspension or revocation of a registrant's federal registration to dispense, prescribe, manufacture, and research are under the federal law. So this means that the federal government has the right to control what you're doing. So say if you're doing research on marijuana, they have the right to tell you yes or no on whether or not you can take in the marijuana, do the research you need to find out if there is any medical benefits, and this kind of puts a damper on whether or not we can actually prove anything. Now, as for doctors, when you can't prescribe a certain medication that can help someone, it doesn't really do anything for patients who have any severe diseases. Which kind of brings me to my next point, which is having a certain research plan so that marijuana can be moved to the Schedule II drug list. The Dutch created a research plan to have clinical trials on marijuana, and the goals of this were to have to find if cannabis can be used for medical uses, and if one product could be was found to have positive results, that it would be passed by the Medicine Evaluation Board, so that it can be passed out to all sorts of patients, and also the requirements for the medication to be passed out are for obviously patients who have any sorts of diseases, not some random person, with a medical card. And the marijuana would be put in pharmaceutical dosages, which are oral forms such as pills or edibles, inhalations, which you would be inhaling the smoke of the marijuana, eye drops, or possibly rectal forms, depending on the patient. Now with this, they decided that with the clinical trials that they'd have a double-blinded experiment. Now what this is that the people who are giving the dosages do not know what they're getting. and neither do the patients. So that when they have these experiments, the results are not so tampered with. So that gives a better response for the research that is being recorded. And also with the double-blinded experiment, they get a better record of everything that's going on in between the patients and the medicine that they're being given, so that they aren't being told that they're given marijuana, which can kind of give some sort of effect as to thinking that, oh yeah, I'm going to feel so much better because of it. Now, I'm going to come about is medical marijuana not having or not being proven to have medical benefits, which is false. In the LA Times, the marijuana bill being officially introduced to Congress on June 23, 2011, Lamar Smith stated that marijuana use and distribution is prohibited under federal law because it's high potential for abuse and no accepted medical use in the U.S. Now, I find this to be false because we have no official research. Because of what's going on with all these limitations, we can't officially prove this. Now, patients who have severe diseases such as cancer, AIDS, and anything like that go through severe reactions with their medication, such as cancer patients with chemotherapy. Chemotherapy causes mostly nausea and vomiting. Allison, Mark, and Janet E. Joy, who both co-wrote Marijuana as Medicine, stated that this is caused by several sensory centers in your brain and digestive tract that are stimulated, which causes those queasy feelings and those feelings of wanting to throw up. Now, people state that marijuana helps them in many different ways. Most of the time it's, alleviating nausea, suppressing vomiting, increases appetite, and relieves pain and anxiety. Now, I've personally seen a couple people go through cancer, and it's not a very nice thing to go through, to not being able to eat because you're vomiting all the time, to feel sick, to lose your hair. And I've seen someone who's now in his 30s, been diagnosed with an incurable cancer, is now at the City of Hope going through experimental medication dosages, and a matter of 2 months, he's lost all his hair and looks as if he's dying. He has dark circles around his eyes and he's thin, but he doesn't want to take medical marijuana because of what's going on. He's scared that he could get in trouble, or that because there's not sufficient research, he thinks that he might become addicted, and that's not the case. And so, as a parent, you tell your kids, don't do drugs, don't drink alcohol, be a good kid. But when there's no official clear-cut line between the federal and state government control over marijuana, we can't officially say that you can't do it because we have no official proof of research for marijuana being, having no medical properties. And so I think that the HR 2306 bill should have state control so that we have a clear-cut line. We can tell them, you can use it, but only if you need it as a medical pain reliever or for nausea and anything like that. And so in this speech, I told you that the Schedule I drug list and the Controlled Substance Act put boundaries for research. Second, I told you that moving marijuana off the Schedule I drug list and onto the Schedule II will help take away those boundaries so that we can promote research on marijuana. And third, I told you that there might be possible medical properties on marijuana that we should officially go and try. on patients.